Hi, I'm Dr. Singhania from Singhania Clinic, and I'm here to talk to you about medical problems commonly seen in children. I'd like to first just talk about my experience in pediatrics. I have 30 years of experience in child health. I set up and managed a pediatric hospital in India with an intensive care unit and a rural development center. I've been running a clinic for 20 years in Dubai, a children's clinic. At the same time, I worked at the American Hospital of Dubai for 10 years, and presently I'm attached to the Mediclinic City Hospital, Dubai, for the last 9 years. There are some common medical problems that I'm seeing in children in Dubai. One of them is recurrent coughs and colds. Now, this is often seen when children start school, when there is a change in weather. The biggest problem of recurrent coughs and colds are that they can result in too many antibiotics, which may not be necessary, or they may cause miliary effusions, which then can affect a child's attention and language problems. So when we presented with a child with recurrent coughs and colds, it's important to find out why the child is having these episodes. It should be more than 6 per year, and it should be to say that they are more significant. And we must look for the focus of infection, whether it's adenoid infection or ear infections or poor drainage, etc. The other thing is, of course, fever. Now, fever can really make a parent panic, but fever is a natural reaction to an infection in the body. And in fact, many years ago, they would actually create fevers by giving injections of milk in tuberculosis, because fever would help to fight the infection. So fever by itself is not dangerous, but if a fever goes above 38, then, and especially in young children below the age of 2, then it's time to see the doctor. Allergies. Now, allergies are common. And what are allergies? Allergies is the body's reaction or overreaction to what it sees as foreign proteins. So these children have an overt reaction to maybe pollen or dust mites or dust, or even something they eat like eggs or cow milk or gluten. And what then the body does is it produces antibodies like IgE in large amounts to fight what it sees as foreign protein, and then the child develops symptoms. So the child can have eczema, can have chronic or recurrent rhinitis or colds, can have tonsillitis, frequent tonsillitis and ear infections, etc. So it's important to identify a child with recurrent coughs and colds or with eczema or such problems. It's important to identify the allergens so that the child can be removed from those to prevent these symptoms. Asthma is another common condition seen here, and by definition, asthma is recurrent. It is not something that can be cured, but it must be managed. The kind of medications we have today, asthma can be managed without any episodes. So just to briefly tell you what is asthma. Asthma is when the air pipes in the lungs are very sensitive and hyperreactive. So when a child gets an infection or the child comes in contact with smoke or even allergens, then these air pipes constrict. They become narrow and the child finds it hard to breathe. And this is when you hear that whistling or wheezing sound. Childhood asthma is different from adult asthma, and often these wheezy children actually outgrow their problems by the time they're 6 or 7 years old. So adequate diagnosis and treatment is a must to prevent any long-term damage to the lung. Sleep disorders are also something I see often here. Sleep disorders could be when a child has difficulty falling asleep, the child has difficulty with waking up, or the child has night terrors, wakes up crying, afraid, and when you try to talk to the child, he or she does not seem to respond. So sleep disorders can affect a child's learning and general health as well, including growth and development, and must be treated. Feeding problems. 25 to 30% of children may have some form of feeding problems. Either they are very fussy fussy, or they don't chew properly, or they have to be force fed, and often this causes a lot of conflict in the family. The parents are stressed, creates a lot of behavioral issues. So these are some of the medical problems. At the clinic, we also do monitoring of normal growth and development, because these are essential as part of follow-up of normal kids, and you monitor the child's progress, and if there is a need for intervention, it can be provided. This is particularly in premature babies, in low birth weight babies, or babies with any kind of problems at birth. Finally, the biomedical treatment, and this is part of integrative medicine, where supplements, minerals, and special diets are used to address physical complaints such as chronic diarrhea or constipation, sleep disturbances, eczema and rashes, even difficult behaviors. In fact, juvenile delinquents way back in the 1940s, they realized that giving them milk increased behavioral problems. So behavioral issues, frequent illnesses or immune dysregulation, allergies, asthma, they can be treated through integrative medicine by giving special supplements, minerals and all. And of course, biomedical intervention is well known in neurodevelopmental problems like autism. It increases social awareness, it improves their cognition, reduces their fogging, and improves eye contact, etc. So this is another aspect that we deal with at the clinic. If you're seeking help, please book an appointment at Singhania Clinic by calling 0442988498 or email us at reception@singhaniaclinic.ae. Thank you for watching.